Porter County. Welcome to the POCO Wellness Hour on WVLP 103.1 FM, your local community radio station. I am your host, Carrie Honeycutt, Care Coordinator with the Porter County Health Department. Each month, we bring you 2 brand new recordings all about overall health and wellness, community connection, and the partnerships that keep our community thriving. Whether it's prevention, care, or just staying connected, our goal is to help you stay informed, inspired, empowered, and engaged in your wellness journey right here at home. And today we have a very special guest joining us to share her insights and expertise. We have Amy Krupa, one of our very own Porter County Health Department nurses. She is also our STI coordinator. Thank you so much for being here today, Amy.
Oh, thank you for having me.
So let's get started and keep building a healthier, more connected Porter County. So tell us a little bit about yourself and how long you've been here at the health department.
I actually just hit my 3-year anniversary working here at the health department.
Nice.
It just flies by. I did work for 2 years in the ICU during COVID at Porter here in town, and also 2 years prior to that in med-surg at Porter as well. So I'm a very locally grown little nurse here. But yeah, so 3 years.
That's great.
Yeah.
Great. And I love working with you. I think you're great. And so I'm happy to be here talking with you on my first hosted show.
Woo!
So the reason we wanted to have you on the show today was to actually talk about sexual health, what is STI, what is STD, and just kind of dig in, have a conversation about that's really for anybody of all ages, and talk about how we can stay healthy that way. So my first question to you would be, what do you mean when you say sexual health? Why is it something everyone should care about?
Well, everybody has their own body that they want to take care of, right? And if ideally, we want to routinely check on it. So I tell patients who ask the same question, well, why do you go to the dentist every 6 months or so? Why do you go to the optometrist every year? Because you're using those organs every day. You want to make sure that they're not in decline, or at least staying in optimal health, and watching for early warning signs. Same thing with all of your private bits. You want to make sure that everything's healthy, or if there's a problem, that you see it sooner rather than later.
Okay. So is it just to talk about for young people, elderly, all ages? Like, talk to me about that. How is that conversation look like for every stage in life?
It's always going to be individually tailored to the patient, and especially looking at someone's different age groups as well, because I never want someone to think, oh, well, because I'm retiring, therefore I don't need to worry about sexual health because, I don't have a partner now, or we're not having kids. That's absolutely not true. You can still be sexually active, even in your golden years. And then same thing when you're a budding teen, that's when our hormones are likely raging. And I would say, is it better for a child to experiment and find out potentially the hard way, or is it better for a child to know, like, here's how things work, here's how to keep it clean, how to not get infected with something either? And when I say clean, I don't mean clean of infection. That's part of a stigma that we don't want to say is, oh, I just went and I got clean. I'm cleaned. I'm checked. I'm fine. I mean clean as in, like, how do they physically in the bath or the shower take care of themselves? That's a huge part of sexual health.
Okay. I did not think of it that way, so thank you for mentioning.
Yeah.
So what exactly are STIs or STD? We hear that as well, and how common are they?
So they're actually one and the same, but STI is the more politically correct term, because if I was to tell you, tell a patient, I say, oh, you are now diseased with this sexually transmitted microbe, you're not going to feel great hearing you have a disease. It hurts a little less to say you have an infection. Same thing with, like, if you've been infected with, the flu, or infected with strep throat. You don't want to hear you're disease-ridden. That's part of the stigma that we try to combat, because if you make it less stigmatized, less of a negative experience to talk about, then you can actually, like, be open to asking more questions and receiving more information and getting better care. So STIs, case in point, is the same thing as we've heard before. The big common ones are gonorrhea, chlamydia, syphilis, HIV, AIDS, which are not the same thing. anybody who has HIV can go into AIDS, but not everybody who has HIV has AIDS. Big difference there. And then, of course, HPV, herpes. There's a ton of things out there, and you just won't know until you ask questions. Or if you get a report from me.
Okay, so you mentioned they won't just know that they have it. Mm-hmm. So a lot of people actually assume they'll know if they have a disease. Correct. Or not a disease. See, I'm saying the wrong word.
No,
or
it's
an
okay.
infection.
It's okay.
So is it always true that they'll know? Like, can you have an infection and not know?
Absolutely. 90% of all of those STIs I just mentioned previously, everything from chlamydia, gonorrhea to herpes, HIV, 90% of people who have any STI likely won't know anything's wrong. They won't have any sores or discharge, anything that makes them go, I shouldn't Netflix and chill, I should just chill. It's the same as having any kind of respiratory infection. That's why we go in and we get swabbed, because we maybe know something's wrong, but we don't know exactly what it is. So I always tell my patients that you're never going to know until you test. And it's better to test routinely or even just one time before something starts showing up and making your red flags go up.
Okay, so are there some that more commonly you may have symptoms and some you'll just never have symptoms?
It's a interesting question, because it depends on the body that you physically have. Most of the time, my gals are the ones, those who assigned female at birth, they're the ones who feel something's off, either in their menstrual cycle or just something about the normal discharge from their private parts, that they're like, it smells different, it maybe looks a little different, or it's coming and going in a different time. My dudes, those assigned male at birth, don't generally have those signs and symptoms. So unfortunately, it's dependent on like what you're born with, and also how in tune with your own body you are. Because I promise you, there are some people who will say, oh, yeah, that's totally normal. And I would say, sir or ma'am, that's no.
Okay. So really, then it kind of goes back to what you said, get tested. Mm-hmm. And if you are then have a sexually active lifestyle, then probably should get tested more than once, maybe?
Yeah, so we had a great question during the training when I first started. One of the state IDOH people came over, and they tested all of us on how to, they trained all of us on how to test for HIV and everything else. And they'd said to the group, would you test Mother Teresa? And the answer is yes. And I'll tell you why. It's not because she's, secretly living her best life outside the habit. No, not at all. It's because she was born from another human being. Okay. You can absolutely acquire any of those STIs just through the birth canal or even through a cesarean. And you can happen during gestation from mom to the baby. And that's not saying anything on the mom. It's just, it's a kaleidoscope and a cascade of different things that can pass on an STI. So you really, with the fact that you maybe know your body, but don't know the signs and symptoms of an STI, or you've had a fun time one time, even years ago, if you're not going to see anything on your body or feel anything, you're never going to know until you test. So I say at minimum, even if you've only had sex one time with one person, just get to know your baseline. That's the best way to start knowing your body. And by baseline, I mean, yes, go in and get tested, or go to just any pharmacy and get like an at-home kit. You can get tons of those, like CVS, Walgreens. And just know, starting out in your first test, do you have something that you should go speak with your doctor about? Or are you ground zero, you got nothing going on? And that's fantastic. That's a huge step in maintaining your own sexual health. Because then if you are lucky enough to get a partner or partners in the future, you can say, hey, here's my baseline. Here's how I got tested. You can be part of the effort to make it less uncomfortable and say, hey, before we engage in any fun further in this relationship, let's get tested together, get our baselines together.
I never would have thought to get a baseline. So that's actually pretty cool. And I'm actually learning a lot today too. So you mentioned talking to your partner and saying, hey, let's get tested. So I feel like having that conversation would help with stigma, because I think sometimes we don't like to talk about it still.
Yeah.
So why do you think there is so much stigma around STI compared to other health issues?
just one of the many things I think is a problem is that we fear the unknown. And we can often fill in the blanks, especially in negative ways if we are approaching something that has been stigmatized from pretty much the inception of this country in a very puritanical way, that sex is bad. Sex is naughty, which I'm not here to tell you it's not. I'm not here to tell you how to believe or how to live your life. But if we approach any kind of activity with our body as inappropriate, therefore worthy of punishment, you're going to associate these STIs as a form of punishment for having sex. That's within a marriage, that's without a marriage, whatever. The bottom line is, it doesn't take any kind of a person who is, angelic like Mother Teresa or super bad. If you have sex even one time, if you're born from a person, you're at risk. And that's not to say everybody's walking around with something. And if you do have something, it's actually a lot better now to have something than back in the 80s. Because again, that stigma was there, that it was a punishment, that you deserved it. So we're trying to get rid of the negative connotations of sex. I often tell the kiddos when I teach them at juvie, I say, listen, you just need to test even one time. Because if you don't feel any of these symptoms, you're going to go off living your best life, not knowing you're potentially infecting your partner or partners.
Okay. So you actually go and talk to at the juvenile services?
That's actually my favorite part of this job.
Okay.
I say it and I mean it. I would totally do it for free. But I love it because they're so hungry for knowledge. And I really don't want any listeners to think, oh, it's just kids who are happy to get out of their holding rooms and, just be little hooligans or whatever. No, they're really hungry for the knowledge of how their bodies work. Just how to take care of themselves, and they deserve to know. Like, just same thing. Like we all deserve to have. Like we're talking about the baseline. How healthy are we? What's our cholesterol level? How much do I need to not go to Red Robin's and treat myself? Like it's the same thing. How can I reduce my chances of getting hurt when I think I'm otherwise okay because I feel fine,
okay,
or it feels good?
Yeah. So in talking with our teenagers, and even if you've talked to individuals who are older, I'd be curious to know from your experience, what's one thing that people are surprised to learn about STI?
That ultimately an STI doesn't matter who you are, how educated, what color, ethnicity, what creed, religion you have. As long as you're a warm body, you are a host. And even one time, be it intentional or an accident, it can incur these kinds of infections. And then you might just not even know. They might not even be on your radar. So as long as you go get tested and you know your baseline, you can start your way to treatment, or you can know how better to keep that baseline in a neutral, healthy. I'm really trying not to say anything that would offend anybody. I'm trying not to say that, but just to keep yourself healthy.
Okay. All right. I appreciate that.
Yeah.
So I actually have grown children, but when they were younger, I kind of talked about using protection and protecting against infections. And so sometimes I'll hear, well, I take birth control, so I'm protected. So what can they use to protect themselves? What can someone use to protect against infections?
So I'm really glad you brought up birth control. That's something else I talk with the juvie kiddos, is that I say, guys, what does birth control protect against? What does it control the risk of? And it's acquiring a child during coitus. It's not protecting you from chlamydia, syphilis, any of that stuff. So being on birth control, however you do, with it, an IUD, spermicide gel, condoms, abstinence, whatever floats your boat, or, pills or a shot, as long as you're keeping up on that, that reduces your chance of acquiring a baby. What you want to do to reduce your chances of acquiring an STI is, condoms also do that, but there are some that can be spread through just the friction of skin on skin. I'm not saying like a handshake is going to spread herpes in that way, but if you are in the moment and you are rubbing skin to skin, herpes is actually shed through your skin cells, and it can actually pass that way. So condom won't help that much in that case. Reducing your number of partners. I'm not saying to have none. I'm saying to reduce your number of partners, to get yourself and your partners tested, and also to just keep up on that routine testing. If you're really scared about, oh, I should test as frequently as often, and I'm not saying because you're going off and, quote, living your best life, okay? Every 3 months would be the soonest I would say someone should test for these STIs because of an incubation period with HIV. That one takes about 3 months for if you do encounter a partner and you acquire an HIV virus and it gets into your body and it takes root. It takes about 3 months for any STI test, that's a finger poke, to detect and let you know, hey, you potentially have HIV. So if you're worried, every 3 months is when I would test. If you want to be routine, no matter the number of partners, unless you have a change of partner status, I would say every year. So think about it as like checking your eyes at the optometrist. You just routinely maintain it.
Okay.
Mm-hmm.
All right.
The other thing I would hit on too, sorry to interrupt, is
go ahead.
So the fun fact I like to kind of blow kids' minds with when I talk about juvie is that there's actually a cancer that is spread through sex. We actually, as humans, I would never have known this until this job, that we can actually pass tumors onto each other. And that's not a super common thing, thank goodness. But it is linked with HPV, and that is the human papillomavirus. So when I tell the kids that, I'm not trying to scare them straight. I'm just trying to let them know what their reality is. And it's actually super common. A lot of us have had or are currently with HPV right now. Thankfully, we don't know it, we don't feel it, and we can kick that infection in about 2 years. But the problem is, when you have HPV, you can either kick it, you can start to develop what's called genital warts, and they often look like little cauliflower that can actually blossom more and more as the flare-ups get worse and worse. And sometimes those go away, sometimes they don't, but you'll always live with it. The other more rare form is when HPV turns into cancer. It's actually the number one cause of cervical cancer here in the U.S. And the tragic thing is that this is entirely preventable with the HPV vaccine, which I know is a hot topic. So if I can.
Yes, please keep going.
Okay,
this is great information.
So I do have a lot of parents who are concerned, and I'm not trying to make fun of them, but they'll say, oh, I don't want little Timmy to get the HPV vaccine because then little Timmy will have sex. I really don't mean to be mean. But little Timmy's going to do what little Timmy's going to do. And that's not to say you're a bad parent. That's not to say that you're not watching him or her well.
Right.
But, little Timmy's going to grow into older Timmy. Little Timmy's maybe going to go to college or trade school or go to the workforce. He's going to experiment. He's going to learn. Maybe he doesn't. But it only takes one sexual encounter to acquire the virus. And you're going to say, well, Amy, you said, it causes cervical cancer, and that's in those assigned female at birth. Absolutely. Problem is, though, it affects the guys too. So it can affect them with their private parts. It can affect them actually in the back of the throat. That's a very common one. One of my favorite voice actors from the Dungeons & Dragons Critical Role, a voice actor acquired HPV in his throat, which is detrimental to a voice actor. But thankfully he got the treatment, which, like any cancer, involved chemo, radiation. But he had to endure all of that when he could have prevented it with the HPV vaccine. And it's a really great thing because this one vaccine has, just among teenage girls alone, seen a decrease of 88% of HPV cancers and genital warts. Now, Thankfully, those two cannot coincide with each other in the same body. Once you get the HPV virus, you can't get the one that causes warts and cancer. You only get one or the other at a time.
Okay.
I don't know if you can get both concurrently, but you can't get them at the same time. But then also in vaccinated women, okay, we're talking about cervical cancer, the percentage of those cervical precancers caused by HPV in vaccinated women that was linked to cervical cancer later on in life has dropped by 40%.
Wow.
And these are real numbers. These are real people who don't have to endure, the stigma, the feeling of being infected, of being diagnosed with cancer, the fear that can have, and the treatment that you may be able to be responding to. Because sometimes we all know cancer doesn't like to play by the rules. Mm-hmm. So I guess the biggest thing I could say about prevention and protection is knowing your body, routinely testing, and using the tools that we have available to us now, which are the HPV vaccine, condoms, which we give all kinds of safe protection barriers out at the health department, testing for low to no cost. There's tons of resources out there.
Okay.
Just do not use the other tool we have, which is the internet, without reason. Please don't ask Google AI, what does this bump look like? It will tell you everything.
Oh boy, yes. I think we've all tried to self-diagnose.
Oh, me too. I'm dying of all the things right now.
Yeah, no, that could be creating you much undue stress or anxiety.
Oh, yes.
You need to be seen or get tested. So the HPV vaccine, so I actually know that started coming out when my kids were younger, I think, or a little bit older. So tell me about that. So what age? Is it just for girls? Is it for boys? Like how? Give us a little more information on that.
Yeah, so that's a great question, and I love it because it just harping back to the fact again, any virus or bacteria that you could come in contact with doesn't care what bits you're born with. It doesn't care how old, young, smart you are. It just wants a warm body to grow in. So girls and boys should all get them. Everybody should get them. Because again, it protects against 90% of cancers caused by HPV. And we're talking cancers. Now again, people might get a little bursty when I say this, but your kids can absolutely get this because your kids can get exposed, and this is a sexually transmitted infection. So again, this is not going to cause your kids' sexual drive to kick in. That's preteen time. Unfortunately, that's when hormones get released by the brain, and that's when they start feeling things stronger than we'll feel them in our 30s, 40s, anything. The earliest the CDC, Center for Disease Control, actually recommends you can get it is 9 years old. That is not to say that is standard of care for everywhere. That is not a hard rule. That is just a recommendation that they say you're safe to start them at that time. Okay. But generally, if you're going to start having that talk with a doctor or with a school nurse, usually they're saying about 11 or 12 years old is when they would routinely get it. And that's when they're going to go and get their first tetanus shot for the adult formula anyway. That's when they're going to get their first meningococcal ACWY. So to me, I'd rather have one doctor visit, get 3 pokes, be done, than go get my 2 and then maybe come back another time. Okay. So to sum that up, earliest is 9 years old per CDC. Routinely started at 11 to 12. Takes about 2 years to get the full immunity because you get your first dose, and then 6 to 12 months later you get your second and last dose. That is, though, before starting at the age of 15. You only get 2 pokes. If you start at the age of after 15, you have until the age of 43 to get started. I know, 43, right? I didn't know that either. Yeah, I thought, I graduated college twice now. I'm out of that luck. No. To the age of 43. But if you start after 15, you have to get 3 doses. But it's still the same efficacy. There was actually a study that followed a group of women for 12 years. I think the group of women was about 40. And it found that there was little to no reduction. Actually, I would say no reduction in protection of HPV with those vaccines.
Okay. Wow, 43. Because I think I remember when I worked at the health clinic, and it was, like I said, fairly new, it was like up to 25 or something, so they extended the age. Mm-hmm. Okay.
I'll be honest, I don't know when that was.
I don't either.
But I started here
pretty cool.
20 years ago, and I can tell you that was 43 was the age for max for starting HPV when I started here 3 years ago.
Okay. Awesome.
Yeah.
That is some really good information. Yeah, I don't know that we think of HPV when we think of STI, but it also is part of your sexual health.
Yeah.
So, so I know that the health department, we do STI testing. We're actually getting ready to run a special the week of Valentine's.
Yes.
So it'll be $10 instead of $20. It's cash, and it's, you make an appointment, you can walk in, whatever you want to do, correct?
Yes, Monday through Friday, we take walk-in appointments. Get here when you can, because I don't want anybody getting in here and missing out, because it is true. Instead of the $20, it is $10, and we test for, I tell people any and all the above. You're basically just paying to sit in my chair and hear me rant at you like you've all been listening to me rant before. But I also give you test results. So we would test you for HIV, hepatitis C, syphilis, chlamydia, gonorrhea, and this is not an STI, but we include it with is pregnancy for anybody as well. Okay. So then if, let's say, heaven forbid, you actually don't even need testing because you tested before and you got a result that says you've got something. If it's any of those infections, I can either provide the treatment on site as long as you show me either a physical copy or a screenshot of that result with your name, your date of birth, when you were tested, and what the results were. Or I refer you to care. And I don't want anyone thinking, oh my gosh, this would be like really expensive. It'd be out of my jurisdiction. I'll just live with it. That's absolutely your choice, but I would encourage you to at least talk with me because it's really not as expensive as you'd think. It is nowhere near as remotely just difficult to get this kind of treatment. And there are so many different organizations out here who would love to help. I got to give a shout out to my girls out at the Gary Health Department. They are part of the Disease Intervention Specialist group.
Okay.
They are not nurses or doctors, and they are their own state-trained employees. They are the gurus of STIs. I love them. They can help find folks who have been infected. They can provide treatment, further testing, and they do it to like low to no cost, because their goal, my goal, everyone's at the Porter County Health Department is to just get you tested, get you treated. Because as my girls over there at the DIS would say, get tested and know your status. And that's half the battle.
Okay.
So Monday through Friday, we take appointments, walk in from 9 a.m. to 3 p.m. You can do cash, debit, or credit. There's a 3% electronic processing
3%,
fee, I think. So, but yeah, we would love to have anybody who wants to come in.
So what would you say to someone who's really feeling nervous or embarrassed about coming in, and, how do you help them feel comfortable? Like, I would be nervous. I don't want to go in and talk about what I'm doing in my private life. And
oh, for sure, yeah. I would first approach it as I've kind of been doing this time when I work with my patients. Is just, you are a person. You make choices. You're not making good or bad. You're just living your best life. Maybe you know your body, maybe you don't. All that matters is, one, you put yourself first. So as soon as you get into my chair, I automatically look at every patient and think, you are absolutely so brave for doing this, because you're treating yourself to getting to know your body. So please don't ever sit in a chair and endure a session where you think, oh, these nurses are judging me. Oh, they're looking down on me. Do they think I did the X? No, we're happy that you're taking charge of your health.
Okay.
That is huge. And the other part, I would say, is truly just look at it as you're here to get your this particular set of organs checked out, just like you would at your cardiologist or your enterologist, so a heart doctor or stomach doctor. You wouldn't be embarrassed if you say, hey, doc, I've had a stomach upset for the last 3 weeks and I can't eat without feeling nauseous. You shouldn't feel shame for not feeling well and for asking questions about how to get better. Same thing with your private parts.
Okay.
And then get prepared to hear all the bad dad jokes from me. I'm sorry.
Bad dad jokes. Okay. So when someone either comes in or schedules an appointment for STI testing, do they always meet with you? Can any of the nurses do it? So how does that work?
Any of us. We are a safe space. Anybody can come in and get tested. Everyone here we want to help. We are nurses. We just want to help you feel better in your body. And I joke, but it's kind of true. I really don't want to call people and say, hey, you have a partner or partners who was listed as a potential exposure risk to yourself. I need you to come in and get tested. That's not a phone call anyone wants to hear. We want to help reduce the number of STIs to 0, which means we want to make our neighbors, our friends and family feel better about themselves.
Okay.
So you can really live your best life.
So you mentioned having to make a phone call. Do you sometimes have to make phone calls to notify someone that they are at risk? Or
Yeah, and it's never anything where, let's pretend I have a couple, Jane and John, all right? And let's say one of them stepped out of the relationship, or we don't know, maybe they had a partner before joining together and they brought a souvenir from that previous relationship. We don't know. All I know is, let's pretend Jane had something. I need to call John. I would not tell John who it was. I would just say, hey, John, my name is Amy. I'm the STI coordinator at the Porter County Health Department. You've been listed as the contact to someone who has an STI. I wouldn't say what kind, because I don't want anybody to really flare up or shut down or make accusations. I'd say, hey, I just want you to come in and know that you can get tested. I'd like to offer you that kind of care.
Oh.
Yeah.
That's a hard call to make, I bet.
Yes, and another reason I love my ladies in the DIS section of District 1 here in Indiana, because they are just so phenomenal how they handle this.
Okay. All right. Great.
Yeah.
I did not know you do that, so I learned something new as well. That's because, like you said, anybody can do the testing, so then I'm like, well, what is it that you do that's different?
Yeah.
That the other nurses don't do, like what additional things? So anything else that we should know that you're doing as a STI coordinator?
Sure. So thankfully, I don't have to make that call, because I have a lot of partners who, when they do come in, they say, well, I'm going to go tell my partner. And they do. And I see the partner come in and we get treated and everybody's fine, which is amazing.
Good.
The thing that I primarily do is I do break that news to that patient in the clinic. And I tell people, and I'll tell all you listeners here too, it is never easy to hear you have an STI, be it chlamydia, gonorrhea, anything. But especially when I break the news of HIV, which I do. It is thankfully on the decrease because, hey,
Yeah.
we're doing great. I love it. It's a collective effort in public health to get that down to 0. But I do tell people, if you have this STI, whatever it is, it's better to get it now than it was back in the 80s. Medicine has advanced so far. Screening, knowledge in general has advanced so far. At least it's now, because a lot of times we take care of you. Even with PrEP, I don't know if I've gotten to talk to you about PrEP before. So,
I know a little bit about it. I mean,
Yeah.
I'll be honest, I see commercials on TV. So,
nice!
I don't know much about it, so.
And you know what? That's actually my tagline is I didn't know about that until I worked this job. And again, I've been here 3 years. So, but PrEP, it stands for pre-exposure prophylaxis. So it is, I liken it to, but it's true, the birth control of the HIV virus. So, and this is for guys, gals, everybody. If you take PrEP as prescribed, which is either a pill a day or a shot every 2 or 3 months, just like birth control, you cannot acquire HIV, no matter how you have sex, who you have it with, and how many you have it with, even if they themselves are living with HIV.
So it actually protects you from getting.
Yes.
So it's not, is it just for someone who's very sexually active, or
It's for
anybody?
Anybody who wants to have sex, even with their one and only, with their threes and only, doesn't matter. Anybody who wants to have sex, the only caveat is they cannot already be diagnosed as living with HIV. Now, if that is a person's case where they are living with it, they know their T cell count, they're taking medications to get the virus load down in their body, what they instead take is the flip side of PrEP. So they take post-exposure prophylaxis. So it means just after they've been exposed and acquired the HIV virus. They take it. It's their medication that they take every day for the rest of their life, so they are managing this condition. But that rest of their life part is so amazing because it's no longer a death sentence for a large amount of people like it used to be. You can actually live a very long, average, healthy life. You can have children. You can have sexual relations with your partners. It's not a death sentence like it used to be. And PEP is a large reason for that.
Okay. I did not know. So how long has that been around?
Ooh, that's a good question. I think it's the early 2000s.
Okay.
I want to say. But the cool thing is too that we actually refer people to care with the DIS, and also along with that, the Aliveness Project. Their big focus also is HIV,
Okay.
and they can link you to low to no cost of PEP and PrEP access, as well as testing for all the STIs that I do too.
So do you have to have a prescription from your doctor for those things? Do they work with doctors?
They work with doctors, they'll work with insurance specialists, they'll even work with those who do not have insurance or who maybe don't have access to a lot of financial means. Their big goal is to reduce the count of HIV in Indiana, in Porter County, in the United States, in the world. So they're going to do what they can to help protect you, regardless of your situation.
Okay.
You just got to come forth and let your interest be known.
Okay. All right. So, we've talked about a lot of things, and I feel like we could probably keep going and talking about it. So just kind of bring it back to the very basics, in talking about sexual health, how it can still feel uncomfortable, And then, I'm hearing this conversation is very important to have. Do you end up having a conversation with patients about how to bring up to their partner, let's get tested, and using protection, and do you have to kind of advise patients on how to have that conversation, or if they get nervous, or?
Sometimes, but more often than not, they come in very confident and have said, yeah, actually I'm starting this relationship and my partner requested that I come in so that we make sure that we're okay to advance the relationship further. And it's so great to see, because I see that not just in like a certain age bracket, I see it in many different age brackets. So it's just so nice to see that. My advice to anybody who maybe wants to talk to their partner about it is to remind yourself that if you're wanting a partner who's going to listen to you and respect you, that this is a good lodestone for that kind of litmus test. So just be honest. Say, hey, I heard this crazy ranting nurse on the radio who was talking about how everybody's got something, or maybe, I don't know, let's go get tested together. So you can make me the bad guy. That's totally fine. But honestly, just sit down and say, hey, I really care about you and I want you safe. And that includes making sure that we're both safe to engage physically.
Okay. All right. That's great. So for parents and caregivers, what does age-appropriate sexual health education look like? What would you, in your experience, recommend? Or, I mean, you're talking to teenagers. How should they handle that?
I'd say first, know that while it's uncomfortable for you, it's uncomfortable for them too. I don't want to tell you what age to start talking about it with the kid, or kiddos, but maybe once they start asking questions, just take yourself a step back and realize that they are trusting you to ask, and that's a huge boon as a parent, right? But to then remember too that they're scared, and we talked about how we fear that which we don't know. Try your best not to make them associate taking care of themselves physically, sexually, as something to be ashamed about.
Okay.
Because you want them to be confident and to be healthy. And it's hard. I know there's no exact plan for every kiddo, every parent on how to handle it. So no one winds up on Dr. Phil, but
yeah, we don't want that.
No. But the best thing would be to just hold on to the honesty, look for the facts, and one of the best things that even I as a nurse practice to say, I don't know, why don't we go and ask our doctor? Why don't we go and ask a proper internet source like CDC, and let's look into it together.
Okay. And they can even come in and talk to you or one of our nurses?
Yeah, and we would require that they have a parent or guardian sign a waiver. You can absolutely outline things you do and do not want us to talk about. That's totally fine, because, again, this is your child. We would only provide evidence-based practice and information. And, again, our aim is to help keep them healthy.
Okay. And to educate, obviously.
That's a huge way, because we talk about knowing your body, getting your baseline. It's just knowing what's out there and what your body does and can do.
Okay. All right. That's great. So you mentioned about testing and signing a paper for parents to come in and have that conversation with their child. What about testing? So do children 18 and younger have to have a parent with them to get tested? How does that look? So
the bylaws for that are a child can absolutely come in and get tested as young as, I want to say 14, but with extenuating circumstances, not in the cases of assault or rape, they can absolutely come in and get tested as young as 11.
Wow. Okay.
But again, that's up to you as the parent or guardian. That's up to the child. And there's a huge distinction between if a child just had an encounter and they just want to know versus if there was a case of assault. In that case, this is my serious portion of the PSA. If there is an instance of that is not something that the health department can provide. What you need is what's called a SANE nurse, is a sexual assault nurse examiner, and they go and thoroughly check up on the kiddo and the status. So that's not something that we provide.
Okay.
But we do offer the same as the adults. We do the what we call an INSTI test, where we prick your finger like a diabetic check for your sugars. We check your status for HIV, Hep C, syphilis. We would have the swabs or the urine samples done for chlamydia, gonorrhea. And then we would offer treatment as well.
Okay. So if someone was, say, 17 and didn't want their parent to know, can they come in themselves or?
Absolutely. Okay. Yeah. By law, they are allowed to.
Okay. Okay. Yeah, because it can be really scary to talk to your parents, and I'm sure you guys encourage them, talk with your parent or someone that you trust.
Yeah, because we don't want them to hear anything good or bad and think that they have to go it alone. Yeah. And I'm sure there are also times, too, when they think that mom or dad or whoever is going to be more angry than anything, when really we know you guys would want to be there for your kids. So we try to help keep the family together. Yes, yeah. Well, and I think it's healthy to encourage that open communication and conversation. And I can tell you, I didn't want to talk to my parents about things like this. Yeah. My boys are adults now, and they talk to me pretty candidly. Sometimes I don't want to know things, but I'm grateful that they talk to me and feel comfortable coming to me, because at the end of the day, I think as parents, we want them to be healthy. So yeah, and that's part of the community-based approach for maintaining sexual health, right? It's if in an ideal world, the parents or guardians would show children that you can be comfortable and safe when talking about this kind of a topic, and then those kiddos grow up into adults who get a partners, and they ideally look for that same kind of connection in their partners as well. True. That's a good point. Very good point. So recently, I had heard, and actually, it's on our waiting room TV of things that are going around, like in Porter County, what's prevalent or whatever, and chlamydia is listed. Oh, it's always chlamydia. It is. So why do you say it's always chlamydia? Because it's always chlamydia. No, just kidding. But largely it actually is. So so why then? What can you tell me more about that? That's a really awesome question. I don't mean to put you on the spot. No, this is fantastic. I love it because I always learn something new. I would say because is it easier? It's so easy to get, and it's so when I have a case of chlamydia, they either get one of two treatments. So here's one reason I think it's a huge issue. It normally doesn't cause signs and symptoms. Okay. Until usually my gals, they feel something's off, they come in, they get tested, and then both partners or whoever comes in and gets treated. There's always a case where maybe they're on treatment that's either the azithromycin, which is 2 pills in one go, and they're done. Or they're on doxycycline, which is 2 pills a day for 7 days. Problem is... That's a lot. That's a lot. I mean, I'm not great on my own meds. I even have one of those medication containers, and I forget my meds. I am terrible at it, and I'm a nurse. Oh my gosh. So the pill containers aren't just for the elderly? No, gosh, no. Gosh, no. That's my anti-crazy pills. Thank goodness I have it. But I know if I had to do that, I would forget. Absolutely. And that can happen. You can also, when you're treated, when I give you these medications, you're not done after the last pill's taken. You have to abstain actually for a week from sex, because in that last week, once your medicine is finished, you're still infectious. Really? Yes, you can absolutely still, what I say, hot potato it back and forth between you and your partners. So, and this applies to any STI, but once you get that infection, you get the treatment, you have to abstain at least for 7 days during that infectious period. You also have to not have any more sex for at least 3 months. Yes, I know. Horrible to talk about during Valentine's Day, I know. Why 3 months? Because when we test for, usually when it's chlamydia gonorrhea, and we do what's called a test of cure to make sure that the standard treatment was enough for your particular infection with your body and your partners. Now, if you were to do it before that 3 months in 1 week, you absolutely can test, but your chance of having a false positive or a test that says you are still infected with chlamydia and it's actually not true is 90%. Wow. And that's because the little chlamydia bacteria bodies are still hovering in your body. They just haven't been shed from your body. So the test will think, oh, you still have this infection. But actually, it's just kind of like the little dead remains of chlamydia that just tricked the test. So it's easy to think, oh, I feel better. I took all the meds. I'm good. I'm good. Actually,
okay.
You are good once you have that test of cure that says you and your partners are negative. So it's a human thing to not only get an STI, but to maybe keep it or get reinfected because it's so common. You can absolutely get an STI again because there's no such thing as an immunity to it.
Okay.
Absolutely. Even if you were, as one of my coworkers said, a good little noodle and you took all of your medicines and you abstained, great. Yeah, you can go on one date, something happens, oh, you have it again. Even if it's a different person.
Wow. Mm-hmm. Okay, that kind of explains why it might be so prevalent. I didn't realize, I mean, I'm be honest, you take your medicine, you get like I get a sinus infection, I take my medicine, and then I'm good to go. And I think probably, I would just think you take medicine and you're fine.
Right.
And so, wow, that's a lot of education that you have to provide.
But I love it. It's so interesting because I don't know, it's just so fascinating. Like, if I can rant for a smidge about syphilis.
Okay, sure.
That's my nemesis. Oh, it's whoever invented syphilis. I got some words for you. But I did not know that once you acquire syphilis, which is another bacteria, you are actually at your most infectious when you first start showing signs and symptoms.
Wow.
And they are not super obvious. So if you get any kind of like a spot that doesn't hurt, like a sore, and you think, that should hurt, but it's fine. I don't feel any pain, and it goes away, you think you're fine. That's actually when you're most infectious.
Okay.
Yes. So no one would see a little spot and think, oh, I've got syphilis. No, you think, oh, it's an ingrown hair because I shaved too close or whatever. Yep. Yeah. And then you're going to live your best life. And then, oh no, I didn't know I had this, and now we need to go get tested and treated. Maybe.
Okay.
So each of these infections has what's called an incubation period. So we talked about HIV having 3 months. Chlamydia, gonorrhea, syphilis all have different times when you need to be careful of, like, from your time of your exposure to when you need to go get tested and treated. It's just so fascinating. It's so convoluted, and I love it. It's a puzzle. Each patient is a puzzle.
My mind is like spinning because that's a lot of information.
Sorry.
So honestly, though, I can understand why someone may be afraid to come in, and it can be a little overwhelming. And so, I'm just going to, ask you, like, if somebody remembers one thing from today's conversation, what would you want it to be?
Can I have 2, actually?
You can have 2. Ooh. That's great.
Okay, so my second to last, my penultimate thing I would love everyone to know is that just because an STI might enter your life, however it does not always mean that your partner has cheated on you.
Okay.
It's a huge thing, and I'll admit, I came from a home where that had happened. But that's not the case with every time someone gets an STI.
Okay.
It just means someone had sex with someone who had an STI. So like I said before, maybe it was a souvenir from a previous relationship and you didn't know because you didn't feel anything.
Okay.
So then you go and you join up with partner B, and maybe partner B feels something and you go get tested and then you find out. So if that ever happens to you and you're in a relationship, please, I understand that visceral reaction to be angry, to be hurt and scared. I get it. That absolutely does happen. But it might also just be you have a partner who's had a previous relationship, or you had a relationship with someone before, and it's the bacteria or virus is just deciding to make an appearance now.
Okay.
So that's my second to last thing I'd like everybody to know. My first thing is that it always starts with you saying, I'm going to love myself and get to know my status and to ask questions. And that's the bravest thing you can do, not just about your heart health, your vision health, anything. Even like, what's that weird noise that your car is making? You want to know because you want to fix problems before they get even worse. And you deserve to know that.
Okay. Those are 2 very great things to talk about. So you mentioned the internet. Let's not Google everything or use AI.
No.
So where can listeners go to find trustworthy information?
You can absolutely go and look at the CDC. I love the CDC very, very much. They have all kinds of different formulated like info pages for you to look at, not just if you're a provider, because I know I don't know all the Latin words. I like the ones that I recommend my patients see, which is a nice fact sheet, maybe 1 to 3 pages. They give you the highlights of everything. The other thing I would say, anything that has a .gov, a .org behind it, because that is something that is sanctioned by specialists, and it is not something that anybody can tamper with, like on Wikipedia or on Reddit. Even though I do love Reddit.
Okay.
But that's not for a medical thing.
No.
It's a good way to learn fun facts, but that's about it. But yeah, anything with a .org or .gov. So watch out for that. Also, the Indiana State Department of Health, they have all kinds of STI factoids to know. They actually keep track of the rates of STIs. So that's another part of what I do is I report to the state how many infections, how many treatments, and I report the demographics. Were they guy, gal, anyone in between? Who did they have sex with? Or were they exposed through like some kind of a bloodborne STI? And then they actually keep the track of all those STIs. Are they on the rise? Are they on the decline? Who needs more help? Who needs more resources?
Oh, okay.
So anything in those categories.
And then, of course,
the Porter County Health Department.
Truly, Amy Krupa. So that is. I kind of worried we wouldn't fill up an hour. I did, but I didn't, and I think, this was really good and some good information. Me being older, I didn't think I'd know a lot of things, but there's stuff that like from the 80s, being a teen in the 80s and stuff, I didn't know any of this. So
myself, when I was a teen in the 2000s, I thought, if I get bit by a mosquito that bit somebody who has HIV/AIDS, they'll pass it on to me. And it's like, no, there's so many misconceptions that linger still, which, by the way, that can't happen. It has to be from human to human, not from bug to human or animal to human. I'm full of all kinds of fun factoids like that.
Okay.
But yeah, there's so much to learn. It's always evolving. And anybody who says, I know everything, run. That's absolutely not true.
Okay. All right. Well, I think we're going to wrap it up. I think we could keep talking for a while.
Yes,
but
sorry.
I want to get you back to the office doing all the good things you do. Just a reminder, we have STI testing special coming up, and I'll let you fill in the rest.
Yeah, Monday through Friday of Valentine's week. Get yourself ready for that special occasion by knowing your status, getting tested or treated as needed. You and your partners can come in Monday through Friday, 9 to 3 as a walk-in, cash, debit, or credit. It is $10 rather than the usual $20. And you ask if you want for a nursing service, and we'll get you right in, no problem.
Okay. And then real quick, if they need treatment, does the $10 cover that?
Absolutely. You are paying $10 to sit in my chair, let me rant at you like a mad woman, and get you all fixed up.
You don't rant. She doesn't rant. Don't listen to that. That's not true. That's not true. I actually sat with her in rooms, and you're amazing, and you do really good job.
I'll pay you later. Thank you.
No, money's exchanged hands.
No. Just all kinds of factoids.
Great. Well, thank you so much.
Oh, you're welcome.
And I thank you, Porter County, or wherever you're listening from. Thank you for joining us on the POCO Wellness Hour here on WVLP 103.1 FM. Thank you to our special guest, Amy Krupa, for sharing your insights and the important work you do in our community. We hope you learned something valuable from today's conversation. Remember, a healthy community starts with every one of us. Whether it's prevention, care, or staying connected, every step counts. For more information on our programs and initiatives, please visit our website at www.in.gov, local health / Porter County. You can also follow us on Facebook and Instagram for upcoming events, updates, resources, and more. From all of us here at the Porter County Health Department, take care, stay well, and let's keep building a healthier, more connected Porter County. I am Carrie Honeycutt, Care Coordinator for the Porter County Health Department, signing off and wishing you a safe and wonderful week.